Hey, everybody. Thanks for taking time to tune in to Elisha's Bears. This is Pastor Danny. Thank you for following and listening in, especially today. I'm very excited about our special guest. Kim Cook is with us. Kim is a licensed clinical social worker and the clinical director at ELU. I know you work in a variety of specializations and areas, and I want to give you a chance to talk about that. But it says here in the reading that I've done about you that you have served as executive director with Centerpoint Counseling and the director of operations with the North American Association of Christians in Social Work. Does that sound familiar? I
That's
see
right.
you nodding, so I'm going to keep on going. Have you spoken in churches and professional conferences? And you're also a professor. And let's get into your education here. Master of Social Work from the University of Maryland, a
That's right.
Master of Arts from Southwestern Baptist Theological Seminary. What a transition that has to be, just geographically and otherwise. And kind of running backwards here, it says you have a Bachelor of Social Work from Messiah College. Did I say all that right?
Yeah.
Good deal. Well, the reason we're talking, and I said this before we started this, we're going to blame Rick Bennett for this meeting because you're going to be leading a breakout session at the General Assembly here in about a month, right?
Right. Looking forward to that.
Yeah, it's gonna be interesting.
Yeah.
We're gonna pull the Tennessee people, the Alabama people, and the Georgia people together, right? Okay. Can you tell us a little bit about what is ELU and tell us a little bit about the name and what your work is about?
Sure. So, ELU is an agency that does counseling, consulting, and coaching. And so the counseling is pretty traditional, like you would think marriage and family counseling, working with individuals, sometimes working with groups. And we work from an integrated perspective. So, I'll say a little bit more about that in a minute. Coaching and consulting really centers around services to churches and pastors, to nonprofit leaders, to just share with them from a proactive standpoint, help them build up healthy habits and work through things to promote health. So, opportunities like this fit really well into our mission to speak about topics like this. In the counseling and really in all the work that we do at ELU, we're looking to bring together psychology and theology. So, you heard in my own educational background, I went to seminary. I have a degree from Southwestern, but I also trained at University of Maryland in a social work program. And so that duality has always been a part of my interest and my training and thinking about ways that the professional world, the teachings that we have in psychology, sociology, can really add to our understanding of humans, human problems, relationships, systems, and what does the scripture say about how do we bring those things together? Because I don't think they're at odds with one another. I think they actually complement one another. And so, Elu, the story behind the name, there is in summary, it means grace, but the longer story is that there's a story of two rabbis that were disagreeing about something in scripture. They saw conflict between their interpretations, and they went to someone older and wiser, another rabbi, and said, "Tell us who is right. Tell us who has seen this correctly." And the older rabbi says, "Ilu va ilu," which means this and that. His answer is basically both and. Both of you are correct. Both of you see things of value here. There is truth in what both of you have brought into this conversation. And so we wanted to create an agency. My husband and I run ELU together collaboratively, and our desire for him from his pastoral background and my own social work background to create a place where that's the work we're about. How do we find the harmony and how do we bring these things together that sometimes in Christian culture we say might be at odds, and we don't think that's true.
I think that's fascinating. Of course, my degree, I'm kind of coming from a more theological standpoint, but kind of with the mentality, it sounds like all truth is God's truth in
Yeah.
a way as we try to reconcile these disciplines. I was curious from a personal standpoint, what was the gravitational pull that led you into social work, into that field?
Oh, long ago when I was a high school kid trying to figure
Let me
out
get comfortable, Kim.
what to do. What did God call me to? This is a story I tell my social work students. I knew I wanted to help people. I wanted the kind of job where I would be helping people. I knew that was meaningful to me. I did feel a sense of calling in my career, and I knew that I didn't want to be a nurse because I don't like blood. And I started thinking about different kinds of helping professions, and I was introduced to the work of Diana Garland through some of the
Oh, yeah.
things going
Yeah.
on at my church and programs I was in, and that really clicked for me. I thought, "This is what I wanna do. I wanna talk about congregations being a part of helping people in this way." Yeah, that's the story.
That's terrific. Well, we were corresponding back and forth, and the kind of the specific topic I want to get into is clergy burnout. But I want to take a step back. Let's talk about stress in general. And this is from Pew Research Center. Do you find that people are more stressed today than we have been before? And they were talking about the arrival of artificial intelligence and the impact upon mental health.
Yeah, I think we're still learning. I think it'll continue to develop our understanding of artificial intelligence and how that affects our mental health. But, they have said that the brain is one of the last frontiers of science and that we're really just only beginning to understand the human brain and how it works, what its capacity is. In the time of my career, tremendous research has been done, and we now understand so much more about things like neuroplasticity and the ability of the brain to rewire and to learn new things and to adapt. And what we're finding is the impact of stress on our brain and then how that affects our physical health, our emotional health, relational health, spiritual health, all of these things. And there is a ton of research about the amount of stress people are under, and books like The Anxious Generation,
Yeah.
just really talking about how not just the stress, but how it's manifesting as anxiety in people. I think that's really in alignment with what you're saying.
So it's not our imagination. People are being, we feel the stress. And that kind of gets me to the field of clergy burnout. I know there are other kinds of burnout, but this is more or less the neighborhood that I'm most familiar with. I wanted to talk about what is clergy burnout and maybe what are the signs of it? And do you know it when you have it?
I don't know that everybody knows it when they have it. Anecdotally, I'll say in the counseling room, I often saying it before the other person is. So I'm saying, "This sounds a lot like burnout. Have you considered that perspective? What if we look through that lens and evaluate in that way?" I think stress is something that we all experience. And sometimes stress is profound and it then manifests in ways that we might diagnose. So we might say this is depression, or this is an anxiety disorder, or this is acute stress disorder, is another diagnosis that we use in mental health. And burnout is more of a layman's term, but it is in that camp of understanding that the stress has gotten to a place that there's significant dysfunction. There's an interruption to a regular daily living. And the person really isn't able to get past it with just some ordinary pro health kind of things. They need a little extra support.
I was going to ask you this later, but is there a difference between like what, discouragement kind of being part of our daily lives as opposed to depression? I know there may be a clinical depression, but is there a little bit of a difference between the 2?
I think it's the severity is how I would differentiate. The discouragement, the daily kind of getting a bit down. Sometimes we would make a comparison that's kind of like a low grade fever. That's just it's there. You can still function. You've got some low grade discouragement going on, but burnout or clinical depression, those things are much more significant, and they're more like a higher grade fever. They're going to bring more symptoms, and they're also going to cause the person to feel like, I'm not sure I can keep going. And when people
Okay.
start to get that sense of, I don't think I can keep doing this, then that's a real red flag.
Yeah. Well, I'd always thought this to be true. And of course, there's research about this. Barna put it this way, and I'm not sure how long ago this was, but they were talking about a relationship between the health of their pastor impacting the health of the congregation, and that's probably not a big surprise. And they talked about balancing the demands of spiritual leadership and church management and personal wholeness. How does the clergy health impact the health of the congregation? I mean, if the pastor or the minister is not doing well, what might be the implications as far as how the church is going to react or what might happen in the church?
Yeah, there's some fascinating research that applies family systems theory. So this would be an example of something coming from psychology to church health models. And Roberta Gilbert would be one of those that's written a lot about this. And what we see is that the pastor, so one of the ways this is described sometimes is like DNA, that the pastor inserts his DNA into the life of the congregation. And often that's unintentional, something you're not aware of, in the same way that a parent passes on habits to a child. They don't always think about those things in a conscious way. It just picked up. And so, one of the key ways that we see this playing out in the life of a congregation is as the pastor experiences more and more symptoms, is less and less healthy, and more towards burnout, you end up with an anxious congregation. So, an anxious system, and you see the anxiety in the system. So, some of the same kind of striving and pressure, and even some critical thinking, that negative self talk that we can do inside our own head, you start to hear that expressed out loud in the life of a congregation. It's real easy for a congregation system, that family, to burn out as a unit.
That's really interesting what you just said about the DNA of the spiritual leader and how it might resonate with the church. Along those lines, if I don't know when you start looking to blame someone or a group for this kind of thing, it's like the statement I read recently, a clergy burnout happens when churches expect pastors to do everything and pastors oblige. Is that an oversimplification? In terms of responsibility, would you look more at the minister or more at the congregation, or is it a mixture of both?
Yeah. Uh, I think it's a mixture of both, and I it would depend on the congregation. We might be able to come in and do some assessment and get some clarity, but just like a family has generational patterns, a congregational system can have generational patterns. So a pastor may be stepping into a system, a congregation that has a long-standing pattern of underfunctioning. In family therapy, you can break down the components into there's typically underfunctioning components and overfunctioning components. And it could it could go either way in a congregation. The congregation could be underfunctioning and putting expectations on the pastor to overfunction. The pastor could be under functioning. I think that's hard to do with the dynamics of church life and the
Yeah.
expectations being what they usually are. But the pastor may be putting some of that on himself with his own perfectionism or achievement oriented identity, that he may be putting that pressure on himself, and then that's starting to replicate into the congregation. So it's hard to say one answer. I think it does depend on the situation, but I think there's this symbiotic relationship between the pastor and the congregation that reinforces those patterns.
Does age and gender have an impact on burnout or depression or those kind of clergy issues?
Sure, it does to some degree, but I think a person's own resilience factors are really where I would shine the spotlight. And I think there are situations and seasons of life where our resilience is maybe a bit lowered. So just like we know with couples that the rate of divorce at certain points across the lifespan is going to be higher, and there are certain stressors like new babies or aging parents, empty nesting, those things tend to correlate. I think we would find some lifespan correlation on risk factors for burnout for pastors. And those may vary a bit with different genders, where those spots are, but there are definitely going to be places where you have to be much more intentional about your own personal self care and paying attention to your emotions and your spiritual walk they're called disciplines for a reason, right? Like, you have to
Exactly.
really engage in them intentionally because you may have some particular vulnerabilities.
Yeah. Well, I'm sure in your line of work, and it's true in mine too, that it's helpful to have some kind of continuing education along the way and try to be part of a peer group or a professional group. This is obviously an opinion, but do you think clergy do a good job of continuing education or maintaining peer groups? Or to put it more specifically, how does isolation fit into this whole issue of burnout?
Yeah, there's some interesting, even in the secular society, some research currently going on about loneliness and the impact of loneliness on our physical health. They have found is just as detrimental as smoking is to our physical health. Loneliness being the negative component, the opposite being connectivity and having community around you, is gonna have such a proactive factor in wellness, and I don't think that pastors are encouraged to do this. The system, some of the people writing about this, one being Diane Langberg, who's written a lot about clergy misconduct, she says that the system itself creates isolation and it encourages a spirit of, I can do it myself. I don't share with other people. It's too risky to be vulnerable in that way. And one of the things you had said in our correspondence was a question about clergy and friendships. And I think
Yeah.
that's a real issue that kind of go back to that system. Like, the system doesn't encourage that. And so clergy are gonna need to be really intentional about building those close, true, authentic relationships where you can speak openly and honestly to people. There is a lot of research about that need, yet I don't think that seminaries are preparing clergy in that way. I don't see a lot of emphasis on
That's what I was
that.
going to ask. Yeah, that's what I was going to ask you, Kim, because, both going to seminary, do you feel like we're coming out of seminary getting what we need to prepare us for these kind of things?
Not 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 generally. I'm hesitating because I think there's some denominations that do it well. They're very intentional about this, and they tend to be more of a diocese model where there's already a lot of structure around clergy appointments. Um, they tend to have a system for this, but in my personal experience, in more of a congregational model, clergy are left to form these kind of groups and relationships on their own, and there are people that are doing that, but even still, sometimes there's a mistrust if it is coming from a denomination or a larger organization that this could come back and hurt my career. And so I think
Yeah.
the organic groups are really some of the most effective when people are forming a small group and doing life in community with others that can speak into their life.
I'm not sure about the numbers. There are different resources we can go to, but our topic today is about clergy burnout. Are we experiencing an epidemic of clergy burnout? Because it seems like we read a lot about ministers going through difficulty, but I know that's not true of everyone.
Yeah, I don't have numbers in front of me, but I do think there's been some research about the thought process of clergy. I've seen about the number of clergy that are considering resignation or the number of clergy that feel isolated and alone, number of clergy that can't identify one close friend in their life, really at alarming numbers. They're all always like those things I just mentioned, majority of pastors feeling this way. So I think in terms of red flags, we know those are resilience factors that would mitigate burnout, and pastors are saying they don't have these kind of friendships. They don't have this kind of support or even a positive feeling about the work that they're doing. I think some of the research, we're gonna have to get a couple years out to get a better snapshot of this, but I think the pandemic has been a key factor for a lot of clergy. Personally, a lot of people I know that are in church ministry have um, experienced this just in the last 5 years.
Well, I was going to say this for later, but since you brought it up, Kim, this is your fault. I'm going to talk about it now. But you mentioned the pandemic, and I posted something on my Facebook page. It was like 5 years ago, and I was sitting in my sunroom, and I was doing, like, a Bible study online from Facebook Live, and I know it's 5 years ago, but on the other hand, it was just 5 years ago, and there was this pastor, a Presbyterian pastor named Alexander Lang, and he wrote this article. I'd never heard of him before, but it was entitled "Departure: Why I Left the Church," and it really became a viral sensation. My point is, he said that I have become part of the great pastor resignation that came in the wake of the pandemic. And I think you alluded to this. Are we still dealing with some of the effects of the pandemic? Because he talked about the immense pressure of the job, feeling lonely and isolated. He even pointed out current political divisions that he was dealing with. Do you still deal with ministers and laity about still struggling with the after effects?
I do, and I think that isn't entirely surprising because I think they were part of the first line helpers. They
Right.
were part of that first line response. And so what we know about those kind of positions, those kind of careers is that they tend to kind of stabilize the people around them and then become aware of their own emotions and like after the crisis have a chance to process. So if we're working with first responders from the military or EMTs, the observation would be they have to, this isn't really probably surprising to anyone, but they have to have an established sense of safety before they're ready to start doing any of the emotional processing. And so that's the lens I see that through for pastors. I think they need to stabilize their congregation and those that they're caring for. And then this deep sigh of how am I? I'm starting to realize I'm not okay.
We're both seminary grads. I want to take you to the Old Testament.
Okay.
All right. Because whenever I think about discouragement and isolation, I go back to the story of Elijah. And I was going to ask, as it relates to, he had this tremendous high, and then he had this low, and it seemed like the prescription was to take a nap and eat. Do you think, or to sleep? How does sleep and eating well factor into our mental and emotional well being?
It's such simple advice. Sometimes we think it's too simple, but our sleep and our eating, our physical wellness, tending to those things are crucial and really helps to level our endocrine system in ways that are hard to replicate otherwise. So I would add another one to the list, which is exercise.
There you go.
It doesn't have to be anything crazy, a walk, anything that raises your heart rate up to that cardio level is gonna really help not just your physical health, but it helps reset the hormones in your body, and we need that. We need movement in our health plan, we need healthy eating, we need sleep, those are really important. But like I said, the research about loneliness and the impact that that has on our physical health also shows us we need community. So, a total plan to prevent burnout really involves thinking about relationships and physical health and spiritual health. It's like multifaceted. So, yes, like sleep and eat a snack, have a nap. Those are great resets and a really important part of a long term plan. But also, we want to have like a multifaceted long term plan.
Yeah. I wanted to come at it from the opposite standpoint, maybe from people in the pew who don't understand, about clergy burnout and mental health. And how do you respond to the person that says, why can't you just get over it? I was reading this quote. Martin Lloyd Jones said that a depressed Christian was a contradiction in terms and a very poor recommendation for the gospel. And to suggest that if the pastor was depressed, maybe it was the result of a secret sin. So if you repent, or why can't we just get over it? And for those who might look at this and kind of gloss over it, what are they missing?
We have to go all the way back to the beginning. If we're talking about the Old Testament, we got to go all the way back to Genesis and recognize that when the fall happened, when sin and illness entered into the creation, it didn't enter from the neck down. Our bodies are affected from the brain all the way down to our feet. So, depression is a biological illness and it happens based on some of the things we've already talked about endocrines and hormones and how the brain functions and the neuroplasticity of the brain. So, all those things have been affected by the fall, and we have limitations in our human body. But yes, at the same time, here's the both end. Here's the theology and biology. There are depression incidences that are related to a hidden sin, that are related to an idol in our life that we're giving into. There is absolutely a darkness in our existence here that the evil one is seeking to destroy us and um, to pull us away from God. And so, yeah, there's spiritual component and there's biological component, and it takes careful consideration to think about. So that quote you read is really a simplistic understanding of depression. It misses so many other ways of understanding.
I know you've done some work and research in the area of trauma, and there's been a lot written, and rightfully so, about sexual abuse and physical abuse in the church. And not too long ago, there was a big headline in the Houston Chronicle about the Southern Baptist Convention and about trauma, especially with women and children. I wanted to talk to you about just briefly about, have you talked and worked with people who have gone through that and maybe have been church hurt? And what does it mean to be church hurt?
With a number of survivors of those kind of situations. And that is a reality that continues on. And we have not historically done a good job as the church in addressing those things, acknowledging the reality of those things. So thanks for bringing that up and for making space to talk about that, because I know that it's an uncomfortable topic to a lot of people. We want to think of the church as a place of refuge and safety, and sure, I would define as any of those kind of situations where there's been an abuse of power, where people they've been hurt by a place that should have been safe. They've been hurt by people that should have been people they could trust. And sometimes we bring our own baggage from our family of origin into our expectations of a church, our own presumptions about what a church can do for us or should do for us. And so I recognize there's two sides to the story. Sometimes there are expectations that things be done for someone and they get their feelings hurt because that wasn't done. But that's not exactly the same as the kind of church hurt you're talking about, which is really an abuse of power.
In one of my previous churches, I was there for 12 years. And over that period of time, and I lost count, but I buried about 160 people in my congregation. And some were, you think about their age, but some were unexpected and surprising. And I knew I was going through some issues in a period of discouragement, but it gives me the opportunity to ask you, what is the cumulative impact on a minister or on anyone really when you're dealing with death, loss, and grief over a period of time? Does it have a psychological and emotional impact?
Absolutely. Absolutely. And I was struck as you were sharing that, to compare to other professions, if we thought about a doctor who had lost that many patients, or someone in the military that had lost that many people in their unit, we have a bit of more of an automatic compassion and a thought about the heaviness of that. I think culturally we understand that there is absolutely an impact to
Okay.
facing that kind of grief. There's a term in psychology called secondary trauma, or vicarious
Yeah.
trauma. And that's another factor that I think pastors experience, not just the grief and loss, but also walking through traumatic events time and time again with individuals, that you as the helper, you experience that trauma as well. It's secondary, but by being so entrenched in the crisis event with them, that you're experiencing some of the same hypervigilance, some of the same feelings of anger, grief, depression, all the things that we would expect in a traumatic event. And so the cumulative effect of that is a wearing down of the resilience. And we're going to see more vulnerability to depression, to anxiety, to even to PTSD as someone experiences things like that over and over again.
Yeah. Well, getting back to Alexander Lang's blog, he talked about each congregation is different in size, different personalities, but he talked about the struggle of carrying the stories and stressors of about 300
Mhm.
people. And I was going to throw out a term called differentiation. Do you think pastors have difficulty with this? when it comes to knowing the problems of their people and not allowing the problems of other people to become our own? And I guess similarly, how do we create boundaries?
It goes back to that over-functioning term. Sometimes it's due to a pastor over-functioning that he carries that. Instead of sharing the burden with someone, he tries to carry it for them and takes too much on his own shoulders. One of the ways that we can set some boundaries is by being in community. So in counselor communities, we have these kind of peer groups that you talked about that we'd love to see happening more and more for pastors, where we talk about how things are affecting us, and we take turns real deliberately going around. It's your turn to share. It's your turn to share, and to examine how we're carrying things and where we're having countertransference, getting our own story woven into the story of the individual we're helping. And I think that's something we could do a lot more training with pastors about so they can recognize it in themselves. Some of the other ways we can set really practical boundaries about time and availability. And I know some pastors will set a limit even on how many times they'll counsel people in their congregation. So I'll meet with people up to 3 times, they might say, and then after that, I'm referring them out to somebody else because
I'm a big fan of referring people, Kim. I think that's a good thing.
pastors just don't have the bandwidth to be all things to all people, and so you can be a counselor, you have skills in it, but most pastors would say to me, "I don't have 24 months to walk alongside someone while they recover from trauma." It's more than the position allows of the other responsibilities on your plate.
Yeah. Well, I've got a few more minutes with you. I was going to ask you about, we've been talking about clergy burnout. What would you say to ministers about the subject of burnout, and maybe about how churches can help their ministers as they're perceiving different signs about burnout?
I'd like to start with the church first, and I think the church can be much more deliberate about asking and caring for the pastor. And I think we sometimes have a structure where we expect the pastor to be too much. We expect him to be like Jesus to us instead of having Jesus and recognizing the pastor as a representative of Jesus, as a shepherd for the congregation. And we need to care for our shepherds. And one place where this can be inserted into the life of the church is the pastor should have a review, just like employees would have at their job. And that review can be a time of intentional care for the pastor. So, asking about how they're doing, how are they feeling in terms of burnout? What are some of the things that they're engaging in to care for themselves? It's pretty easy at that point to ask about those things and just bring that into a natural rhythm of church life. And having conversations like this, be more aware, leadership groups thinking collaboratively about how do we carry the load of the congregation, recognizing some people are paid staff, some people are lay leaders, and together we carry this rather than an idea that there's one person that should carry it for everyone. So it's a mindset shift in expectations. But the pastor has to do their own inner work to figure out if he is in a healthy place, if she is paying attention to her stuff, as we might say, that um,
That's a good
remaining
catch-all
there.
term.
Yeah. Yeah, it's very clinical, isn't it?
Pay attention to your stuff.
Pay
Right
attention
out
to
of
your
seminary
stuff.
classroom.
One of my friends wrote a book called Know Your Story and Lead with It. And I love that idea that we have to always be paying attention to our story and the things that we bring into a situation, whether that's old habits or expectations, thought patterns we get stuck in, ways we form our own identity about wanting people to like us or trying to avoid conflict. And having people around you that know you well enough to say, see your stuff. I see you going in that direction.
That's good. For our listeners, if they wanted to follow you or they wanted more information about what you do and where you are, what information could you give them? Where can we go?
Yeah, sure. I appreciate it. The organization ELU has a website, www.eluccc.org. That was 3 C's for counseling, coaching, and consulting. And we're really easy to find on social media. We have a presence on Instagram and Facebook where we try to put out a lot of positive content for people for your feed. And if you need any further assistance or want to contact me, you can just use the contact us through our website and that'll get routed to me.
Any final thoughts? Did I leave out something or anything that you wanted to throw out to us?
I just love that you're paying attention to this. There is both accountability for congregations. We already said there can be abusive systems and there can be unhealthy individuals. And I think this is a really important conversation to have so that we can help what you said, the great exodus of pastors. We want to turn the tide on that and help people sustain in this really important calling.
Good deal. Well, we've been grateful and glad to have Kim Cook with us today. And I want to thank all of you for joining in and encourage you to follow the podcast if you haven't done so already. And as always, thank you for listening.